Hi everyone, my name is Dr. Keemberly Kim. I'm a board certified dermatologist and Mohs surgeon here at Westlake Dermatology in their Houston West University location. And today we're going to be talking about one of my favorite treatments now that we are officially going into what many call laser season. So it's time to get rid of any sun damage that we accumulated over the summer. Weather's getting a lot cooler now, so this is a good time to just have a refresher on ablative resurfacing treatments. And thank you so much for taking your lunchtime to join us today. I know lunchtime can be very precious for several of us. So during today's session, we're going to be covering Ultraclear briefly, sort of how it works, if you're a good candidate for the treatment, what to expect with the treatment session. We'll end off by covering a couple of patient cases, going over their before and afters, and then we'll end with a brief Q&A session. If you have any questions at any point during the presentation, feel free to submit them. I'll try to get through most of them by the end of the presentation. And then I do encourage you to stay until the very end. You'll find a surprise that may end up being very beneficial for you if you decide that you want to proceed with a treatment. Okay, so briefly, before talking about Ultraclear specifically, I just have to cover sort of how lasers work in the world of aesthetic dermatology. So they've been around for several decades. They offer a variety of options for addressing different skin concerns. Not all lasers are the same, but essentially you can split them up into two major categories, so ablative and non-ablative lasers. The Ultraclear is an ablative laser, so it works by physically removing the very superficial layers of the skin and then creating these controlled micro injuries in the skin that stimulate collagen and elastin production, and this is going to lead to that rejuvenation that we're looking for. Ablative skin resurfacing has been around for several decades, so for over 30 years we've had ablative skin resurfacing. Traditionally, the CO2 laser has been considered the gold standard when it comes to ablative skin resurfacing for rejuvenation, but most recently in 2022, the Ultraclear was launched and it was FDA cleared for the treatment of fine lines, wrinkles, age spots, scar treatment, and skin resurfacing. And then more recently in 2024, it was also approved for the treatment of pigmented lesions and for the treatment of vascular dyschromia or redness. And so the way that it differs from other ablative treatments is traditionally for when it came to ablative laser resurfacing, the heat from the lasers was being delivered in one pulse. And this led to more collateral damage. So what this meant for you as a patient was that there was more downtime, more pain. With the Ultraclear, the technology is new in the sense that it delivers that energy in micropulses. So for you as a patient, that's going to mean that you're going to have less discomfort during the treatment and less downtime. So it's just a depiction showing these micro columns where the laser energy is being delivered, and then when you have these channels, after you deliver that energy, you're going to have more collagen and elastin production. Okay, so how do you know if you're a good candidate for this treatment? So anyone who's interested, well, first of all, what I really like about the Ultraclear is that it's a very versatile treatment. So if you're interested in treatment of tone, skin texture, you're wanting to treat wrinkles, scarring, any sort of pigmentary concerns, sun damage, age spots, overall skin rejuvenation, or for my younger patients who want to start a pre-rejuvenation routine, I can tailor the settings and treat each individual based off of what their concerns are. The nice thing is that it's a treatment that I can tailor to all types of skin types. So for my more fair complected patients to my more darker complected patients, I can tailor it to different age groups. I have treated patients as young as 3 years old and patients in their mid-80s. So it's a treatment that's suitable for all kinds of patients and all ages. And then there are different treatment modalities. So there's a very superficial treatment modality that requires less downtime, actually no social downtime. You can come in, I like to call it my lunchtime laser. You come in if you're looking to address any sort of skin texture, tone, sun damage, pigment. If you just want to get that overall glow, then your 3D Miracle or Clear settings are going to be a good option for you. If you're wanting to treat more deeper wrinkles and scarring, then we have the more moderate settings where there is some social downtime. So I'd say on average, most patients require about 3 days, but if you're a slow healer, it can take up to 5 days, and then by a week out, you're fully healed. And then if you're looking to treat more deeper wrinkles, we can be a little more aggressive with our advanced settings. We can incorporate a little bit of laser coring, and that will require more downtime. So more aggressive treatments typically will require more downtime. Okay, so what to expect when you come in. I like to have everyone come in for an initial consultation. We can discuss what you're interested in addressing, which treatment option might be right for you, what sort of fits your lifestyle. I'd like to go over any pre and post procedure instructions, how to prep your skin before having the treatment performed, what to expect the day of, and then there's quite a bit of wound care after the procedure, especially if you're going for a more moderate or advanced treatment. So it's good to know what to expect afterwards. The actual day of the procedure, you'll come in. You can do topical numbing. I would say that if you're doing a very superficial or light treatment, topical numbing isn't necessary, which maybe what some people are looking for, especially if they're wanting to come in really quickly for like their lunchtime laser treatment. But for the more moderate and advanced treatments, I typically do recommend topical numbing. I'd say that most of my patients actually tolerate, even up to the advanced treatments, the whole procedure without having to do anything more than just topical numbing. And the treatment session can last anywhere from 15 minutes up to an hour, again, depending on what treatment modality we're using. And then I wanted to just show you a video of sort of what to expect. So this lovely patient came in. She wanted a quick, more superficial treatment, didn't require any numbing, and you can tell that she's very comfortable throughout the procedure. We're talking. So again, I like to stress how comfortable this procedure can be. And then I think I have another patient here. So this is just a closer up of our 3D Miracle, so the more superficial treatment. Also, this patient didn't require any numbing, but she's very comfortable as well. Okay, and then we sort of went over this, and I'll actually have depictions later in the presentation of sort of what to expect after the procedure. But again, your recovery is going to depend on sort of what we're treating, how we tailor your treatment, how aggressive we're being. The 3D Miracle, little to no downtime. You'll leave looking a little bit red. You'll have some sloughing over the next few days. And then for the more aggressive treatments, you'll be pretty red and swollen for, I'd say, about up to 3 days. On day 3, it tends to take a turn, and you'll have mostly peeling over the next few days and mostly recovered by a week out. Okay, so we're going to cover a couple of patient cases. I'll start off with my more superficial treatments, my 3D Miracle or my Clear. And this is pre-laser treatment. You'll leave a little bit red, and then 2 days out, you can see you'll have a little bit of sort of darker areas on those areas that are about to peel. Some patients might still be red 2 days out, but I'd say most of the redness clears out about 1 day after treatment. And then around day 3, you'll start to peel, but you can tell it's a very light peel. You'll feel like you have basically a sunburn, and even the recovery is very similar to a sunburn. You'll be red, you'll feel warm, and then you'll have exfoliation and sloughing over the next few days. And this is a patient that had a 3D Miracle, so that very superficial treatment. You can already tell that she had improvement in overall pigmentation, sunspots, and then this is another patient who also had a 3D Miracle. You could tell already she had significant improvement in overall pigmentation and sunspots. gives you a really nice glow after the treatment and 1 month apart. And as I mentioned before, it's suitable for all skin types. We just tailor it depending on what we're treating. But this patient also had a 3D miracle. You could tell there's already an improvement in her tone and texture. And I love this photo because it highlights how like even a very light treatment can help out with treatment of these lentigines or sunspots and freckles. And this is just after one treatment, 1 month apart. And let's not forget about the neck. If you're interested in treating pigmentation on the neck, this can be a great treatment option. And even if let's say you don't want to do a full face treatment, if there's one spot in particular that you're bothered by, especially these very superficial, what we like to call seborrheic keratoses, it's a great option. This was one of my patients that after one treatment session had an excellent result. She had a very superficial, a very thin seborrheic keratosis, and she had significant improvement after one treatment, 1 month apart. Okay, so for our more moderate treatments, this is going to be your Ultraclear. There's a little more downtime. So pre-laser treatment, this is immediately afterwards. You'll be red. Some patients may have some pinpoint bleeding, and that tends to completely settle by day 2, 3. And you can tell here by day 7, she's already fully healed. You'll have a really nice glow. I like to counsel patients that there might be some residual redness or erythema, but that will go away over the following weeks. This is one of my patients that I treated with Ultraclear. She came in wanting to treat just overall, like for rejuvenation. But I love this picture because it highlights that, it also treats redness. So you can tell before she had a bit of rosacea, and patients will initially be a little bit red immediately after the treatment, I'd say a week out, but this is 3 months out, and you can tell there's a significant improvement in that redness. And then I'd like to highlight this photo too. She came in for fine lines, and you're going to feel an improvement a week out, but the real magic kicks in about, I'd say, several weeks out, and you can tell that your body starts to make more of that collagen and elastin, so there's a significant improvement in these fine lines here around her eyes. And then this is another one of my patients. She came in wanting to treat her acne scarring, and this was one treatment apart, 2 months, one treatment of Ultraclear, 2 months apart. It's also a great option when it comes to scarring. So this is another patient that I treated. She came in with these hypertrophic scars. They were very firm, itchy, and we decided to treat it with Ultra alone. And this is after 2 treatments of Ultra, 3 months apart. The scar was completely flat, no longer indurated, and she was very happy with the results. And then let's not forget about the hands. We don't want our hands to give our age away, so it's a great option when it comes to treating sunspots on the hands. And this patient had acne, rolling acne scars, and you can tell after one treatment she's already had a significant improvement. So an example of how it's a great option when it comes to pigment and lines, if that's what you're interested in addressing. And this is another patient who had great results when it came to the treatment of fine lines and wrinkles. And this patient, you can see she's treating several things. So pigment, she's got acne scarring and wrinkles, and this is after one treatment alone. You can see that she's already had an improvement. And then if you want to be a little more aggressive on the neck and treat lines and wrinkles on the neck, Ultra is a great option. And then this little boy, this is actually a boy that I treated when I was in my fellowship training, came in after a traumatic scar. And you always worry with kiddos, you want to make it as least traumatic as possible for them when it comes to any sort of treatment. So this little sweet boy came in, had some topical numbing put on his scar, and then we treated it while he was sitting in grandpa's lap, didn't cry, and this is after 2 treatments. So like I said, it's a treatment that is, we can use it in very young children, adults, older adults. It's tolerable in all ages is what I'm trying to get to. And then this is one of my other patients that came in for treatment of acne scarring, had very firm hypertrophic scars that she wanted to address. And after one treatment session, there was a significant improvement. The scars were a lot softer. Some of them had flattened out completely. And this is a gentleman who had treatment for acne scars on his cheeks. So this is after 3 treatments. And these rolling scars are really difficult to treat, but there's definitely an improvement in overall texture here. All right, just briefly covering laser coring. That's going to be our more aggressive treatment option. I wanted to show everyone a video of sort of what to expect during the treatment. So you can physically see the holes are a lot more visible and larger than the ones that in the less aggressive and advanced treatment modalities. But this patient just had topical numbing and was super comfortable throughout the procedure, didn't require more than just topical numbing. Okay, and these are sort of the results that you can expect after laser coring and the more advanced settings. So significant improvement in wrinkling, but also some tightening and overall treatment of your pigment. And I love this modality. I believe this is the same patient. I love using laser coring when it comes to around that perioral area. It can be very difficult to treat. I like to use it in combination with filler. So I'll typically have patients come in. We can treat them with some laser coring, and then any of the residual lines I like to treat with filler. And then they tend to do really well. All right, so that concludes my presentation. I'm going to take a look at these questions here. Okay, we have a couple of questions. Okay, so how long do the results last? I have a couple of patients asking questions about cost and okay, so let me first address how long do the results last. So like any sort of laser treatment, the results are permanent. You're going to continue to age. So it is something that I typically recommend that you consider doing sort of like a maintenance treatment after you've gotten to the results that you're satisfied with. So typically, depending on what we're treating, one treatment session may be enough. You'll see significant results after one session, but you're going to, you still want to continue maintenance treatments like any other sort of treatment that or concerns you're trying to address. Like, you're still going to continue to age with time. So it is not uncommon that I have patients come back a year or 2 later to sort of be reevaluated and consider whether they want to undergo another treatment. Okay. And then cost. So cost we can definitely cover. We'll send an email out afterwards. But it really comes down to like what treatment modality we're using, how advanced our parameters are, and then how much surface area we're treating. But we're happy to send this out after the presentation. Do you need multiple sessions to see results? Again, that's going to depend on exactly what we're treating. You will see results after one session, but sometimes it may require multiple sessions to get to a point where we're both satisfied with outcome. Does this replace Clear and Brilliant? And also, does it replace CO2 treatments? I wouldn't say necessarily that it replaces these treatments because they're addressing different things. So Clear and Brilliant or Permea is a different wavelength. It is also pretty safe in darker skin types, but they're going to have different patients with different concerns that are going to be suitable for one treatment over the other. Clear and Brilliant also can address pigment, and it also serves well as a rejuvenation treatment. But Ultraclear also, again, it depends on what you're trying to address. I think can cover a couple more concerns in one treatment session. I can tailor it to do so. CO2 treatment. So it's different. It's similar in the sense that it's an ablative treatment like CO2. But what I really like about Ultraclear is that it's more tolerable and downtime is less than our CO2. But again, it just depends on sort of what you're trying to treat. They can cover or they can address similar concerns though. Can you do full face ultra clear, then spot treatment with laser coring? Absolutely. So I do that pretty often. I will treat patients with just full face ultra clear and then focus more on areas that have more severe rhytids or wrinkles with laser coring. I typically won't laser core an entire face. I hope that answers the question. Does this treatment help with jawline tightening? It can. It definitely can. So that's when laser coring comes into play. It just depends how severe the laxity that we're trying to address is. Is it safe during pregnancy? I would hold off on doing any sort of ablative treatment during pregnancy, just because there are several reasons. So you have higher risk of hyperpigmenting. It is an ablative treatment, so you're making physical holes in the skin, and it's not a common sort of complication, but there's always a risk of infection. It's just something that's not necessary. So I would hold off until after pregnancy. Tiny capillaries around the nose area. I have found that it does help. I think I shared that picture of my one patient who had a lot of redness on her nose from rosacea. So what Ultraclear is doing, it's making those small microchannels in the skin, and in the process, it's also targeting some of those vessels. So it does help with redness around the nose, but I would say it depends on your specific situation. But if you're trying to address the capillaries, there are other lasers that we have available that are probably more suitable to that treatment, or to sort of address that concern. Can it help with keloid scars on the body with the same effectiveness as hypertrophic scars? Depends. I have definitely treated some patients with keloidal scars on their body from acne scarring. And I've had great results, but again, keloids are run on a spectrum. They can be very small or they can be very large. And sometimes lasering is not going to be enough. Sometimes they just need to be surgically removed. How far out is scheduling right now? That is a question for my scheduler. Is this treatment offered in Westlake and Austin? Unfortunately, it isn't. It's currently only in Houston. Happy to arrange, for you to come down here and have it performed. But at the time, it's not in Austin. What's the downtime of laser coring in comparison to moderate treatment? So slightly more downtime than the moderate treatment. For laser coring, I am making larger channels in the skin. So the downtime's still about a week, until you're fully healed. But with laser coring, you might have more residual redness for several weeks out. The redness will go away, but it'll be a little more obvious than what it would be with just Ultraclear. What does the recovery maintenance consist of? So when I talk about, and this is more sort of something we discussed during a consultation, but recovery maintenance is going to consist of vinegar soaks, lots of Vaseline, and then just keeping the areas very clean. And then when can we resume use of makeup? I'd say about a week out. Most people are able to resume makeup. Okay. I believe those are most of the questions. And then before I go, if you are interested in booking a consult, you can definitely reach out to schedule an appointment. The easiest way is to either book online or you can reach out directly to our offices. Oh, one more question. Can you use sunscreen right after treatment? Absolutely. So I typically tell my patients that about day 3 or 4, they can start using sunscreen. Okay. All right. Thank you so much for joining, everyone. Oh, before I forget, there is a special that's going to be running through the end of September and October. So if you book by the end of September and have the treatment done before the end of October, you're eligible to receive a 20% off discount. Thank you so much, everyone. Hope to see you soon.